morning, everyone. Thank you for being here. We are here today to share with the community that we, as we've talked in the past, that we have been working on preparedness and response to the COVID-19 incident in Eau Claire County. We have a strong team. That strong team includes governmental and elected officials, as well as our healthcare partners, along with many, many others. Today, we've taken the opportunity to get elected officials, government leaders, and healthcare partners together to have a local conversation directly about what is happening in this community and sharing with our elected officials at the local, state, and federal level some of the needs and concerns that we have, as well as telling them some of our local stories. We had a chance to do that today, both by phone and in person with some of our partners. On the phone were a number of our state elected officials, as well as federal elected officials. And in person, we had Congressman Kind, who is here today with us, as well as our local elected officials and government leaders. We'd like to share with you this morning a little bit about our preparedness and a little bit about some of the questions and concerns that we continue to deal with. We know that right now we have no positive COVID-19 cases in Eau Claire County. We continue, though, to prepare for that happening, and we continue to work with all of our partners to respond to the significant issues happening because of COVID-19 preparedness with the close down of many of our services. We know that moving forward there will be resource needs, and that is part of our ask. At our conversation today, we really talked about partnering across the aisle and across various sectors to meet needs in the community. And we have a community that works together. We are very fortunate to have that, and we continue to expect that. Some of the key messages that were shared this morning with our elected officials and our partners is that we are focused on testing and supply of PPE, or the equipment that we need in order to keep people safe that are responding. We are focusing on things like surge capacity, and then essential services like our elections are an important topic, as well as transit. We also are prioritizing with our state and federal elected officials how we respond to our highest need populations and continue essential government services. Healthcare is a critical partner in making sure that we flatten the curve so that they are not overwhelmed in this time of need. So today we're going to have a couple of representatives from the group that met earlier today share some statements about how we are prepared at the local level, how we are prepared at the healthcare level locally, and we're going to hear from Congressman Kind talking a bit about the federal preparedness as well. We will take questions at the end, and do know that this is part of our work to assure the community that we are working together. We care about the fact that this has real impact on everybody in the community, and that our response is one that is collective. So I will turn it over, I think, to our local partner first, Dale Peters.
Thank you, Liska. As Liska pointed out, this community has a high pride in collaboration and working together, and this is a time when we are certainly pulling together as a community with local government. So the City of Altoona, Eau Claire County, and the City of Eau Claire are working together in unprecedented ways that is built off that level of cooperation that we've had for many years. And the focus of that is to continue essential services for the community. It's absolutely imperative and important that those essential services can continue to help the community be stable and safe as we go through this. So keeping services like police and fire, having the phone answered when and if you call 911, keeping water in the system. I would remind everybody that the water system in the City of Eau Claire is completely safe. It will remain safe, and the water will remain coming into your home. So of all the different things we need to worry about, one of them you don't need to worry about is having safe and reliable water in your home, as well as sewer services and all the administrative services that it takes to keep those essential services going. So As Lisa mentioned, we're also looking at some other things that you might not think of as essential service, but we believe they are. Working to keep our public transit system open for those who don't have other ways to get to the important things that they need to, whether that's medical care or food, is a priority for us, as well as having an election. If the state deems that we will have an election, we want to make sure that that election can be credible and happen, and so we're taking measures to be able to have that happen. We're doing this through a lot of cross-training, online services, flexible hours, and working with all of our dedicated, hardworking public servants that are committed to continuing the essential services in all of our communities here in Eau Claire. So this is a very coordinated response. It's a time to work together. We're pulling together. And I guess the other part of the message that I would have is this is a community effort, and the entire community. Eau Claire has a long history of working together and supporting each other. Isolation can be challenging. This is a time to reach out to your neighbor, particularly those that are elderly or that are self-isolating, and stay connected and support each other and support your local government. But your local government is here and will be maintaining the essential services, and it's also time for the community and the community members to step up and help each other at this time of need. Together, we will get through this, and together we'll take care of each other as we go through this.
Mark will be next.
I'm Mark Anderson from HSHS Sacred Heart Hospital, and speaking on behalf of all of the healthcare providers. Eau Claire is, as you know, a healthcare hub for our region, and from the very beginning, we've been collaborating, working together, all of the healthcare providers. It's unprecedented. We've made changes that in restricting visitation to hospitals. We've canceled or postponed elective hospitalizations, things that we've not done. It's an extreme situation, but it's something that we're working together on and giving a unified message, unified actions. And we are working together. Our staffs at each of our facilities are planning for the potential surge that we expect. We're also treating, testing, and caring for those folks that are sick right now. We're in the midst of a significant influenza spike as well. So we are addressing those things as we go. We do appreciate the community efforts to avoid congregation, etc., because flattening the curve is what's going to preserve our ability as healthcare providers to maintain through this, to keep the spike down. So we appreciate the public, and we're counting on the public to continue to do that. So we are going to continue to collaborate together and manage our way through this. Thank you.
Yeah, I'd be happy to. Yeah, I'm going to try to move this over just a little bit here. Well, good morning, everyone. Listen, I think it's safe to say that we have, and it's a reminder, some of the best public health departments, some of the best healthcare providers in the entire world right here in this community. And I've been so impressed with the level of cooperation, coordination that's taking place here at the local level in order to address the coronavirus and try to prevent its spread. How deep and how long it lasts is really going to depend, as you've heard here today, from each and every one of us. We all have a role to play working together to try to prevent a pervasive spread of the virus in our community by practicing some uncomfortable habits right now. Social distancing, taking yourself out of circulation, and then doing something that we should be doing, Lisa, all the time, and that's practicing good public health hygiene habits. Making sure we wash our hands continuously, 20 to 30 seconds, cough into our elbows. If you're feeling sick, isolate yourself. Make sure you get your flu shot, given the unusual virulent strain of the flu season this year too, so that you're not occupying needed hospital space right now. And it's going to require a partnership at the federal, state, and local level. In that regard, in the past week, the Congress worked at an unprecedented bipartisan speed to pass emergency supplemental funding bills in order to make sure we're getting resources back home here at the state and local level so they have the tools they need to best address this. The first bill that we passed allocated $3 billion for the development of a vaccine for this virus, and then moving to an expedited clinical trial format, and then a global distribution center. But our medical experts tell us that we're at best 12 to 18 months away from the development of that type of vaccine. Right here? Okay. How's that? Yeah. We also passed a significant appropriation to get more money back to the public health departments. Again, understanding that they have been seriously underfunded in recent years too, and now that they're at the front line in addressing the crisis. More supplies, more equipment that we've heard again today with the meeting that just took place, and making sure those product lines are being up and addressing the shortfalls that exist. And then more money for telemedicine. We live in a large rural area of the state too, and the challenges that our rural healthcare providers face right now. But the telemedicine is something that we've been trying to move the healthcare system in the direction of anyway, and under these circumstances it makes a lot of sense. And then the most recent bill that we just passed is meant to address the economic hardship and the fallout from all of this. Free testing is legislation that I had offered in the past to make sure that those can go in and get tested for free with no out-of-pockets, no co-pays, no deductibles. That should be the last thing on people's minds when it comes to making sure that they didn't contract the virus. We're going to have paid sick leave right now for 14 days and also paid family and medical leave for 12 weeks. This might have to be adjusted given how long this lasts, but at least providing that comfort and knowledge that everything isn't just going to collapse economically. Also, we're trying to fund the Small Business Administration, so our small businesses in need of capital right now has easy access to it. And then working with some of our larger lending institutions, we're asking them to open up more for lending opportunities for small businesses during this time. And then also addressing the nutritional needs that we have in the community. The schools are out, the kids are home, and for many of these students, this is their primary means of getting fed during the day, is in the school system. We want to make sure those programs are still working, that it's available. The Meals on Wheels program for our older population, the various nutritional programs that people rely on the community, there's going to be additional funding for that too. And now we're working on a third package too in light of the economic fallout. There's been some discussion about direct payments to American citizens so they can make the rent payments, make their mortgage payments, make sure that they're still paying their bills on time so that doesn't collapse. And that package is being put together, and hopefully we'll have an opportunity to work on that as soon as we get back to Washington next week. But we're going to be only as healthy as the closest person next to us. We've never been more dependent on a society than the health of one another. And with that idea, with that type of we're in this together mentality, we can get through this. We can minimize the extent of virus spread in our own community and the pressure it may put on our healthcare system, and hopefully limit the effects of this so that people can get back to a sense of normalcy, get back to working, get this economy back on its feet as soon as possible. So we're looking forward to continuing to work with our public officials back home here, the coordination that they're displaying, the information that they're providing. One overriding comment that I continue to hear from folks back home, they just want the facts. They just want the most up-to-date, accurate information so they know what's expected of them and how best to react. And we're going to try to do our best here at the local level to provide those facts with the latest information that is available. So thank you all. Lisa, thank you.
So this was one of probably many opportunities to, again, highlight to the community that we are working together at a government level, both elected officials and government, as well as healthcare, to really look at responding to this disease in an effective way. We do now have an opportunity for questions of Congressman Kind or myself at this point. We are not necessarily focusing right now on specific response in Eau Claire. We will have our regular 3:30 media event today to talk about Eau Claire response, and we'll be focused more on that, those kinds of questions later today. But are there any questions of the media at this point?
I've got questions maybe for representatives from the hospital systems that that might be here. We're working on a story today about whether or not there's confusion for regular clinical appointments. I know that a lot of the hospital systems are basically, we've already seen press releases about non-essential or elective procedures. So I'm just wondering if any hospitals in the region are experiencing or asking patients to take certain precautions if they're going to keep a regular appointment or if regular appointments are being canceled in possibility of a surge or something
Sure.
like that.
That might be a better question for clinics.
Yeah, and again, we don't have representatives here at this point in time to respond to a specific question about what's happening at clinics and hospitals. It is our understanding through Incident Command that healthcare systems across the area are communicating to their patients that there is a need to focus on responding to the most urgent issues in the community right now, and that non-urgent issues are not being addressed. Also, for social isolation reasons and for distancing reasons, those non-essential activities are something that we are strongly recommending not happen. Other questions?
This will kind of fit in that same realm of too specific, but there's been talk of drive-through testing at the hospitals. How close are we?
So the question is related to drive-through testing. There is drive-through testing happening in different parts of the state and country. We do have prioritization of testing that we certainly are wanting to be the key message. We are anticipating drive-through testing in this area fairly soon, and we may have more information about that later today.
Can you provide some insight on daycares, whether they'll be closing or why they're not closing?
Certainly. So the question is related to daycares. One of our really essential services in this community is to have childcare available for those people that are responding to an incident like this. If we have public health, healthcare, police, fire, those essential services worried about their kiddos at home, we have no workers to do the work. So the governor, in his directives and mandates, has exempted childcare from those organizations that do need to close. We are trying to keep childcare open as much as possible in this community and across the state. And we are working with childcare to make sure that they are very carefully following precautions for not spreading disease. We do have resources available in Eau Claire for people that have questions, and we did share that information at our press conference yesterday, but we certainly have been posting that regularly, and we will get that information out again to those of you that can share it. I think it's important for the community to know that we are making sure that that information is available. If you go to the Health Department website or go to our social media account for Eau Claire Health Department, we have all of that new information posted there, and we're really trying to push people to use that. We post things regularly at that site for community members.
This may be too specific as well, related to medical again, so maybe you can respond. To what degree is there planning underway for potential surge planning related to staffing at the hospitals and actually the medical staff, nurses and others being exposed and therefore being not able to treat patients and stuff? Is that all part of your plan right now, and can you talk about to what degree that's a concern?
Yeah. And I'll have Mark come up, but do know that the question was related to healthcare workers and surge capacity as it's needed. There is a group that has been in existence for quite some time that coordinates public health and healthcare response to incidents like this. That includes all of our healthcare partners in the region. They do work together to not only identify beds and ventilators available, but also do coordination. Right now, healthcare partners are tasked with identifying their assets and resources, and all of us in the community level understanding how best to prioritize and utilize those. So that is in existence. We also got a directive from the state, again yesterday, related to testing and related to healthcare worker return to work. That directive just came out late yesterday, and very clear guidance about making sure that we utilize our healthcare workers when they are healthy and have them not work when they are not, because that is a place where disease is spread. but also not having people stay home from work if we don't need them to because they are an essential group. That guidance literally came out last night and is being shared in the community now. I don't know, Mark, if you have additional comments or not.
I would just comment that the protection that you might refer to is in keeping healthcare workers safe while they're caring for patients. Personal protective equipment is something we use every day for a variety of illnesses, and that is a key issue, and that's one of the reasons that we are conserving that equipment. All of the organizations in the area are conserving that equipment now so that we would have it in the case of the expected surge. So I speak for all of us. We are conserving and also redeploying staff, healthcare workers from areas that are not providing services now due to cancellations and postponed surgeries and things like that, to redeploying them to other areas. So.
And that kind of work is happening across all of our healthcare system partners. Yes?
This might be more of a question for Dale, and again, I'm sorry if this is too specific. You mentioned that the city wants to keep public transportation open. Are there any measures being put in place to keep fewer than 10 people, say, on a bus? Are there any precautions being taken for the bus drivers? Are they having to wear
So the question was related to transit locally, and Dale can respond specifically. Again, the guidance from the state exempted transit from the 10-person or more requirement, just to be clear with media about that. And City of Eau Claire is working very carefully to protect their drivers as well as the public. But Dale, if you'd like to additionally respond. So I think the simple answer is we're keeping transit open and doing everything possible to protect people. It's one of our essential services, especially for populations that are already otherwise challenged. Yeah.
When it comes to community transmission, whether people here go to states that have it or it does eventually come to Wisconsin, what should people be aware of about it? What should they do?
Can you be more specific with your question? What should an individual do that's been in a place where there's community transmission? Is that the question? Sure. So the question is related to community transmission. Community transmission, again, just to remind people, is when we have cases in a community that there isn't a known contact for that individual. So we have cases across the state right now where there's a known COVID-19 positive contact. That would not be considered community transmission, but there are, at least as of yesterday, 3 counties in the state where there is community transmission. So again, transmission where there isn't a known contact with a positive case or travel to a known community transmission area. We do have states across the U.S. and we have countries internationally where there is community transmission. The recommendation for people, if they have been in those areas or in contact with someone that is COVID-19 positive, that they self-quarantine for 14 days. That remains the current recommendation. We may see changes to that over time since we have broad community transmission happening. Certainly anybody that has traveled to an area should be self-monitoring for symptoms that are influenza-like symptoms, as we often say, but that high fever, cough, difficulty breathing, those specific symptoms we are asking people to self-monitor for. And again, to utilize resources correctly and not overwhelm our system further, to only access emergency rooms and urgent cares if someone is in urgent need of health care, not to show up at those locations with a cough, for example, to call ahead to their healthcare provider if they are concerned and really not utilize our typical emergency system if it's not a true healthcare emergency. Yeah?
Have all local tests for COVID-19 been completed in state labs, or are we still waiting?
So the question is, where is the status of testing for local individuals? We have more than 50 tests submitted to State Lab of Hygiene for local testing of COVID-19. We have not received all the results back. Of those results that we've seen, they have all been negative. As I said earlier, a number are pending based on State Lab of Hygiene yesterday announcing that they are prioritizing testing for high-risk populations. We anticipate that some of our tests, which were low risk when they were submitted initially, will be put to the bottom, frankly, of that list. The reason why high prioritized tests need to be put forward is that those are people that are hospitalized, and healthcare workers are in that group. Those are the two prioritized groups for State Lab of Hygiene and the Milwaukee lab. Those are our public lab facilities. We really have prioritized those because those are the riskiest places for both successfully treating people so they don't die and so we don't have spread in the healthcare community. Other tests are being processed and other testing facilities are moving other tests forward. We know that, for example, Rochester Mayo and some of our private labs are testing the lower prioritized individuals as well. But as we have issues with available resources for testing, that may change as well. Yeah.
I just want to follow up on that. I think you said a couple days ago that local healthcare partners are thinking about being able to test specimens. Has that happened yet? Do you think that will happen this week or not?
So the question is, anybody locally running the test for COVID-19? It is not my understanding that there's any local capacity yet for in their labs running to get a result for a COVID-19 sample. Again, just for clarity in the community, we have testing happening. The swabbing is happening in this community. The tests that test for COVID-19 is being sent to an outside lab at this point in time. One of the priorities at the state and federal level is to up the number of places where tests can be run. So we know that that is a priority and we expect additional places to come on board.
Is there any update on translating the material, getting the information out into Spanish, Hmong, other languages?
Yeah. So the question was related to any updates on translation of materials. It was one of our conversation points this morning with our partnership group that is something that we are seeing as a significant need in this community, as are many communities across the state and nation. We right now have some limited available materials in Spanish and Hmong, as well as some other languages at a state level and federal level. Their materials are. We're working on our daily briefings to being available in other languages as well, at least in a print version. Those people that need to have services because of challenges with hearing, we are putting subtitles on our daily media briefing, so that's available for them as well. We recognize that that is a population that we have additional work to do. Yes?
How realistic are all the House proposals since the Senate isn't in Washington?
And if you want to
yeah,
repeat the question,
right.
Thank you.
Listen, we've already passed one dealing with the public health response to this. That has been signed into law. That's moving forward. That's the testing, resources to public health, vaccine development, clinical trials, more telemedicine, more resources to rural healthcare providers, and the PPE shortages that we're seeing. That's done. That's moving forward. We just passed the economic response, first version at least, out of the House. Strong bipartisan support. It's pending in the Senate right now. We're expecting them to take action the next day or so on that. Then there'll be a third, I think, action being taken in the coming week, a greater response to the economic hit that we're taking as a nation right now. That's where you're hearing discussions about direct payments to all citizens so that they can pay their bills and pay their rent and pay the mortgage, and so we don't have a complete collapse of the system. And then support for small businesses that are really going to go through a tough time, especially in those crucial service-related industries that are impacted right now. So it's really been unprecedented speed and bipartisan cooperation we're all in this together. We need to continue to work in that fashion, working with our public officials to coordinate and to listen and respond to their needs, which is one of the main reasons I'm here today. Get feedback from them as far as their capability and where they need additional help. And I can take that message with me to the National Interagency Task Force that's been formed to address this. Great.
Are there any additional questions only for Congressman Kind? We will be having our regular 3:30 media briefing, and we want to focus questions now only on that and wrap up quickly.
Yeah, I'm good.
Short one. Just Congressman Kind, can you speak to those who are still skeptical if they look at this and say, well, you know, look back to this influenza or the swine flu, and they're saying, boy, this is so drastic, this is so far beyond anything we've seen before. Can you speak to those who are skeptics or doubters on the steps being taken?
Yeah, hopefully the consensus is formed now that this is serious and it requires a coordinated, serious response and a role for all of us to play. And we found through past coronavirus outbreaks like this, it's those communities that act the quickest to social distance and to take the necessary public health measures that don't feel the impact as deep and as long. So really, how bad this gets here in our own backyard is going to depend on all of us and what we're all willing to sacrifice in the short term for the long-term benefit of the community. And we found now, even with this virus now, with the impact on China, South Korea, Philippines, that when they can socially isolate quickest, they can blunt the long-term effects to it. So hopefully everyone's bought into that concept right now. Because again, we're in a unique moment in our nation's history. We are so dependent on each other for our own personal health needs. And we can only be as healthy as the closest person next to us right now. That's how you defeat this thing and try to limit the fallout.
Other Congressman Kind questions, yes?
What can the government do to speed up testing and provide more tests for communities that need it?
Well, we, again, allocated a lot of money in order to get the testing regime up and going. There's no question they're slow out of the block, and there'll be plenty of time after the fact to go back and do a review so this doesn't happen again. But really listening to private labs, the private providers too, that have the capability of doing it, I think going to them sooner would have made a lot of sense, but they're now being activated and more test kits are getting out. We still have some shortage areas that we're concerned about. And so we're trying to address that as quickly as possible with the resources that are needed with these supplemental funding bills. And then again, listening directly from the community back home and what our healthcare providers need and what they would like. Let me also say I'm very impressed that we've got providers that are already moving forward with no-cost drive-through testing. I mean, that's what South Korea has been doing very successfully. They've tested over 200,000. It's something that we needed to emulate back home here, and they're starting to do it here. Marshfield, Mayo, Gunderson, the other health systems are setting up these drive-through services, which solves a lot of problems. I think the ultimate gold standard will be no-cost at-home testing. And I think we need to continue to strive for that ideal world. Gates Foundation is working on that right now. They've got pilot kits out there right now for at-home testing. And that could limit the person-to-person contact that we need right now too. So a lot of steps are being taken. Hey, we have time for one more? Yeah.
On that board, what exactly qualifies as small and medium businesses?
Well, it's been defined as 500 employees or less. You know, we tried to make this universal. We got some pushback though, so we couldn't also incorporate the large companies. But quite frankly, you know, close to 90% of the large companies are already offering paid sick leave, paid family medical leave. We want to make sure all of them are doing it. Most of them are pledging to do it. But this one will affect 500 or fewer employees where they get reimbursed through tax credits for paid sick leave and paid family and medical leave. That's 14 days and then up to 12 or 14 days and then up to 12 weeks. We may have to extend that, you know, given the extent of this right now. But we felt that this was a good place to start. Great, thank you everyone. Lisa, thank you so much.
So just to close again, thank you to our elected officials. We really count on you to be partners in this at a federal, state, and local level. and we appreciate the time today to talk about that. A reminder to our media partners that we really are counting on all of you to help us get the message out at 3:30 every day, so we invite you back for additional updates then and an additional opportunity to talk about local questions at that. That will be again here in this room at 3:30. Thanks to all our partners, governmental and healthcare partners. We're a team in this community, and we continue to ask you to go to the local health department website and the local health department social media pages to get recent updates. Thank you.